Hey everyone, how are you guys doing? Um, I miss doing YouTube. I just want to say it's been a while. Sorry about that, but I'm back with another story, another learn lesson and learning experience. As a nurse, right now I'm working as a hospice nurse. Um, it's a totally different environment. It's not like the nursing home where you try to save the patient. You do everything that you need to do in order for them to survive and have a get back to their normal lives. But here in hospice, um, these are the terminally ill patients. Most of them either have cancer. Uh, most most of them have less than 6 months to live. But one thing I'm learning in hospice as well is that sometimes the prognosis can um, be extended. Sometimes they graduate from hospice, but hospice is challenging, but at the same time, it's very rewarding. This is the time when the family go through a lot of difficult decisions, making sure that everything is prepared, the mortuary, the pulse, whether the patient's going to be DNR, DNI, no tube feeding. So we do care conference. You get to meet the family. I get to visit the patient once a week, depending on if there's any changes of condition. I get to interact with the doctor on a day to day basis. Also, also with the family, I call them once a week or each visits that I make, depending on what the family's preference. And it's a good job, but even if it's stressful, I do have to chart after each visit, so there's a lot of time management that I need to learn as well, being new in hospice. So it's all electronic. You create your own time. You log it in on the computer, and then I'm usually off after 4:30, but I still have to do charting after. I mean, it's I'm still learning. It's only been my second month as a hospice nurse, being a case manager, and the good thing about it is I'm learning so much doing this job, especially with palliative care. And I'm actually thinking of getting my certification as being hospice certified hospice nurse. And I remember I thought that I'm a strong nurse. I remember this patient that I had I have I was talking to the family. I was explaining what's happening to the patient, and then the family started a little bit tearing and crying. So I just have to stop and kind of back off, and I just started weeping with them. You get I think one thing that I'm learning is I'm just a human. I I I do get attached sometimes, but that's something that I need to learn. Leave it as I go home. But like these people, I'm very happy to help them during in times of distress. Also with the family that's going through a lot, and I'm learning about life and death itself. Um, a lot of nurses say, why do you want to join hospice? Isn't that depressing? Isn't that sad? People are dying. But I do remember when I was working at a nursing home, I do have a hospice patient, and for some reason I'm not fascinated, but really interested just to be there for that patient who's dying, um, just making sure that they're comfortable. And I feel like when I see those hospice nurse comes there and get all these orders just to make sure they're comfortable, and I said I want to do what they're doing. So That's why I'm in hospice right now. I'm just very lucky to be able to get the job. I'm not gonna say it's easy, but it's a learning process. I'm not gonna say it's piece of cake. Um, a lot of things that you need to learn how to deal with family. Each family has different dynamics as well, so you have to work with that, and also you have to communicate well, and also you need to educate the family on what's going on with the patient as well as the medication. So you have to pretty much know everything. So, and the good thing about being a case manager is that I do go back to my notes, to my Kaplan, to my Saunders, so that I have something to say to the family when they ask me question. And the good thing about it also is that every Wednesday we do have a meeting with the team. Our team consists of the doctor, a social worker, your team manager. So you basically go through all the patient and you can talk about them, and at least if you have any questions to the doctor, you could always ask and get your order. So that's one thing that I like. I don't have to wait like a couple of days to get a response. You can get your hospice team doctor to get orders. But in general, I really like hospice. It's challenging, but it's definitely new for me. And if you want to learn more, if you have any questions about hospice, feel free to ask me or email me and follow me on Twitter. And that's it for now. If you guys have any questions, feel free. Well, thanks for tuning in, you guys. If you guys have any questions, just put down a comment below or follow me on Twitter. So I'll talk to you guys soon. Thank you so much, you guys. Take care. Bye.